During these extraordinary times, healthcare organizations are delivering care in new locations and ways, while needing to operate faster than ever before. For over 2 decades, VMware's proudly partnered with healthcare organizations worldwide to provide the most powerful digital solutions for our healthcare heroes, doing the hardest work of all, keeping us healthy and safe. Providers are always here for us, and VMware is here for them too.
Well, good day, everyone. I'm Garen Staglin. I'm here today with Brian Moynihan, CEO of Bank of America, to have a very important conversation about management in the COVID-19 environment. We're all feeling a tremendous amount of stress, anxiety, and depression associated with the many factors impacting our lives today. And we're going to have a very specific conversation with Brian about how he, as the leader of one of the nation's or the world's most important companies, is dealing with that. So Brian, you're a global leader around this topic. You and I have had several conversations about it. We've partnered on this, and our work with you and One Mind at Work has been terrific. Why is mental health such an important and emotional wellness of your employees so important to you?
Well, Garen, thank you for doing this, and thank you for the work that One Mind does with us. And you've helped open our minds about this, this whole situation in mental health. But why is it important? Is, at the end of the day, we are a people company. We need the best people to work for us. We have to be the best place for them to work. And to do that, given all the stresses and things that happen with people, we need to have great physical health and mental health. And so the economic case for mental health, you can make it. The moral case is really the case I go. We have to have people who are in great shape physically and mentally so that they can do great work for our clients, customers, and shareholders and communities. And it's that simple. And so we've done a lot of work here with you and others to make sure that we try to live up to that standard.
Yeah, we've proven that it's not only the right thing to do, but it's good for business, as you've just elucidated. So let's talk about another aspect of this. As a large employer, one of the big issues is the accessibility of care. It's not where it needs to be. And we also have this issue of stigma. People feel like maybe if they come forward, somehow they might be discriminated against. How are you addressing those two issues as it relates to this topic?
Well, let's go to stigma and then to accessibility. So stigma, and your group has been a leader, and we had you come talk to, our senior leaders. It's just a constant, I think a CEO is a constant education obligation on this. And the way a CEO educates is to talk about it, to make sure it's talked about by his or her leaders, to get the teammates to talk about it, to get the teammates to feel good that they can discuss some very difficult situations. So, you have to, and then, by the way, you have to have manager training, which is, look, if somebody evidences this something to you about mental health, your reaction can't be anything but, we're going to help you. Here's the resources, how to do it. You can't act like it's going to hurt him. You can't let it hurt him, either one, because the acting is as bad as letting it hurt because people perceive it will. So, it's just really, and that gets down to that moment of truth when that teammate says, I'm having a problem, the reaction of that manager. So we train on that. We literally train on it. Then we have the more broad communication, courageous conversations about, being a parent in this time of stress and what it means. And by opening up the dialogue, you'll get other people to talk about it and say, wait, I just saw one of the senior most people in our company talk about those difficulties. They'll talk, it's okay for me to talk about it. Then you have to make people aware of the access to treatment and access to resources. And so that accessibility through our benefit plans and unlimited, what used to, telehealth engagements for mental health, if 5 or 6 appointments before you have to be prescribed help. Those are critical elements, again, to take away the stigma that I've got to get approval and I've got to prove that I'm got something beyond a clinical diagnosis, all of which is a chicken and egg problem. No, I can start getting help, and it may not be have a clinical case of this order or that order, but I can start that. So that accessibility is critical too. So it's communicating, and it's also communicating that the assets are there for people to be helped. And then just, making sure your managers just start that moment of truth of train the way you want it to be, and would decide as if you had an hour to think about your answer. They decide at that moment, they decide the right way.
So Brian, in response to COVID-19, you have done a number of things in addition to what you've already just discussed with us to add resources to help people cope with this pandemic. Could you give us more about the specific programs that are underway at Bank of America to help your teammates cope with COVID-19?
Well, one of the things that if you go to stress in people's lives, it's going to be financial stress is going to be one of those. And so one thing we did for our teammates is we said no layoffs right when this crisis hit. We said no layoffs, and we've lived up to that, and we'll continue to live up to that. What that immediately did is took away, that idea that their financial life could be disrupted. Even if they're high risk and couldn't work at the moment, which your natural assumption is if you couldn't go to work and you had to be at work to do your job, I might lose my job. We said, nope, everybody's fine. Then we said, then we went after the question of, okay, now I'm at home. My kids just got emptied out of the school system. I am an IT expert because I'm trying to get, Zoom teaching into my house. I'm a classroom monitor and teacher. I'm the hall pass giver. I'm the fixing a lunch. I'm doing the homework with them. All the stuff that was going on, but part of it went on in another building with another group of people around it. Now it's in your home. So we basically said, look, that's untenable. So to work 8 hours a day with that situation, we will give you $100 a day to hire somebody to help take care of your kids. We have 40,000 teammates that have kids. They have about 80,000 kids. 1.5 million days have been used by them. It was a complete benefit. Here's $100. We used to provide about $12, $15 a day to supplement people to put their kids in child care centers, largely when they're preschool. The complete change here was school-age kids being at home. And I didn't have to go through this because my youngest is 23, but I can imagine having 3 teenagers that are supposed to be going to school electronically, digitally, sophomore, junior, 9th grader, or something like that, and how difficult it is. So we took that up. That was the second thing. Then we started to say, testing and treatment and helping people through all the different issues, because while this crisis was going on, we had wildfires, Garen. I don't need to tell you about those. We had storms going on. We had other things going on, and we had to help them through those crises. So we used our LAS teammates to have that engaged conversation. And then we made available the mental health resources and the physical health resources we talked about. A lot more emphasis on wellness, which the endorphins and the aspects and the contest, stepping that up. At the same time, we added the mental health facility. So it was financial, it was household stability in terms of helping there. And then it was, you have a job. Hopefully we can help you with your kids if that's an issue for you right now, or other caregiving responsibilities. And then hopefully we can help you if you're struggling with the mental health. And then, by the way, here's a bunch of physical health resources that just can remind you about movement and staying in some shape and doing your stuff. And so that combination, we hope really help people. And we'll see. It's had great response from our teammates. Our employee score is the highest they've ever been, and went up 6 points last year, this year, in the middle of a crisis. We went to 85% score to 91% score, top 2 box for our employees.
Yeah.
In the middle of all of this, that's, I think, and what we heard from the comments back was, look, you thought about us, and that's what we tried to do.
Well, let's double click on this a little bit more as we think about the various demographic and gender populations within the bank. I think you've got over 200,000 employees around the world. We've just done a survey in the U.S. Mental Health Index where we've looked at various employees, and what we're seeing is 40 to 50% increases in stress, anxiety, depression, lower resiliency. You're doing a lot to address that. But when you double click on that, and I think you talked about this already, women are actually more stressed because you mentioned all that. And in addition to everything, they're the ones worried about getting kids back to school. They're the chief medical officer. But in addition, look at Gen Z. Gen Z, they've already come to you and your workforce with anxiety out of their school. They got more uncertainty about their jobs. How do you think about these specific populations, and how do you sort of listen better or do things specifically with them? Because one size really doesn't fit all here.
I 100% agree with you. And so, the caregiving for kids and parents, that issue falls in many different directions due to societal realities out there. But the reality is you got to stabilize no matter where it falls. And so if it falls more into females in certain cultures and communities, take care of them. Falls more to males, take care of them. Falls to a single parent, take care of that. So we try to be specific. When you think about the kids coming out of school, the first thing we did is we made our summer program for the kids coming in an internship. We went ahead and made it a full program, and we tried to give them as meaningful experience as they could. We didn't truncate it, frankly, because then they wouldn't be home with less to do, honestly, and we want them to work. We want them to get used to our company, so we kept that. We gave an offer to everybody in that program for next year because we didn't figure it was a fair assessment, to say Garen or Brian did a good or bad job in this messed up situation. So hopefully that gave them comfort. We believe in the young kids that we're working a lot with colleges and even in the high schools, thinking that continuum, high school to college to us, how do we think about mental health through that? That's a longer term program. But effectively, when we thought about very short term right now, if we say to all the kids that are juniors going to seniors, or going through a messed up senior year anyway,
yeah.
If you were an intern at Bank of America, you have a job, that takes away one of their risks in life. The second thing we said is the people who come to work in May, we said come to work now. So the kids who graduated early, who are at home, again, in a potentially with their parents after 3 or 4 years not being with their parents, and suddenly, that's going on and the stress of that household impacting them. We said come to work, and by the way, we pay those kids a fairly high wage, and if they were living at home, that's a good thing. And now we're going to bring those kids back to work, probably a little faster than others, on the theory that to get the culture of our company and get the training and get them feeling they're on a career path. Safe, always safe from a healthcare, but we're going to push them back. So we thought about the resources and capabilities. They're there for everybody, but we've tried to think about, based on our experiences and our senior leadership, you're a parent, your 23-year-old's home. What would they really like to do? They'd like to have a job and maybe even contribute, as opposed to sitting here for 3 months because they were going to travel or do something else and they can't. Well, let's get them here working, and we'll give them 2 months off later. So we've been trying to think of how we just lower tension, lower worry, lower stress, and then all the resources we talked about in terms of counseling sessions and teledoc and all that is available also.
So Brian, as you look out for Bank of America, what does the future of work look like for you? Are you going to have people in the office, out of the office? How are you handling this balance as we move into this post-COVID-19 world, hopefully sooner than later?
So Garen, we've always had people work remotely. We had 20,000 people before this started. The unusual thing was we took jobs that were never remote and made them remote. So if a storm came off in the Atlantic, hit Jacksonville, where we have a lot of call centers, they'd shut down for 5 days. We'd spread the work out around the country, and then the storm would pass, and hopefully it wasn't too bad. We get the people back, get the power restored, and people go back to work. This is different because the whole country is affected. So suddenly we had all the call operators in the company in this country at home. 100,000 computers we deployed in like 4 or 5 weeks, and screens and all that stuff. So that started a whole different thing. And so making sure they had the capability to work at home. Some people just don't, and then they couldn't. And then some people's jobs, if you were a branch manager or you had to go to the branch. So we moved you and then had to give you the skills to work in a different job. We had 25,000 high-risk people we took off the line immediately, half of whom could work and the other half couldn't do their job. So we had to reskill them to train them over. So we did this whole triage. And what we learned with all that is, people like coming to work, people like having the social setting of work, and some people like to work from home. And so that will play out I think, and you'll have a little bit, I'd say there'll be more of a bias to a little bit split work week. There'll be more of a bias towards a little less center city, maybe more suburban office, just because of commute. People woken up what's not like to commute 45 minutes an hour, so that'll be a thing. But the fact that we have, the 2,000 kids that came out of school who've never physically met their boss that came out in May, the fact that we have another 2,000 that came out and started working for us last August, who only had about 5-6 months or whatever it would be on the job before they went off, they've got to learn by osmosis in each other. So as it's safe and safely done, we'll be bringing those back. But we're a work from office place. The implications of this, I think, are critical in terms of long term, but I think people overstate how big an impact it'll have. But it's an underlying trend which we are dealing with, and the question is how to handle it well for the teammate to not induce more stress. And we'll have some teammates that say, I'm too fearful to come back. We're saying, forget about it, don't worry about it. We're asking them to come back if you want, several thousand. If you want, come back. If not, fine. And we'll just let this play out until we're free and clear of this thing in another, whatever months it takes.
It's a journey, right? We'll manage it along the way. So you've taken some pretty bold action to address racial injustice here. And I think on your own balance sheet, you issued $1 billion 4-year commitment to advance racial equality and economic opportunity. That's pretty strong. And what prompted you to do that? And what do you expect from the outcome of this?
Well, I think, Garen, we were talking a minute before we came sort of into the formal setting here. This multiple crisis, of which one of them is the healthcare crisis, which actually affected communities, African American and Hispanic communities, with a heavier impact. And there was the racial justice and the George Floyd killings and that impact. And then there's a political crisis on top of this, and just sort of the debates going on and everything. You throw that all in a soup, and that's a pretty healthy thing to deal with. And so, as we thought about it, the other thing that's been on our mind a lot is economic opportunity and mobility. And so we've been thinking about that as a company. So a year or so ago, Tom Montag and Ann Finucane, who are two of my senior teammates, started pushing our Hispanic leadership group and our Black executive leadership group to come up with ways that we could move economic mobility faster. And they were marching a program forward, ready to come to me. Then you hit the George Floyd killing and the other killings and the protests, but frankly, the angst of the teammates, now separated physically from each other, going through conversations in our company it wouldn't have. And so we basically had that program kind of ready to go. I looked at it and said, look, if we're going to go, we have to go big. We have to double down on our efforts, et cetera. So they brought a program, $500 million. They brought a structure to it, which was tremendous. I said, let's double it. Let's add these elements to it, and let's go. And so it's $1 billion program. We basically had 3 elements to this. A $1 billion program that is one element, a courageous conversations platform, which is the second element, but the first and most important element, denouncing racism in any form in the company, ensuring that everybody felt what we believe, which is our company, you can do everything you want no matter who you are, and you feel free to speak your mind without adverse consequences, all that. So that we went through those 3 pillars. The $1 billion pillar, healthcare, job creation, job skilling, entrepreneurship, business entrepreneurship, and housing, all geared to Hispanic and African American and other communities of color. And then the other element I talked about was we gave a $25 million contribution to the Smithsonian, with Lonnie Bunch, who's now the leader of the whole thing. I've worked for the years in the National Museum of African American History and Culture, to Lonnie to create a courageous conversations platform. So going back to the beginning, when these issues hit in our company, the conversations going on in our company, what we call courageous conversations, which are around mental wellness, and people understanding other people have the issues that have been going on for 5 or 7 years, where we create a formal platform, just the need for them went up. And as I listened to our teammates come talk to me, they said, what are we going to do here? And why can't people have the conversations we have at work outside? Mm-hmm. And that's where we create a platform to hope we have a conversation about race, society, and really brass tacks conversations about what it's like to be a Black person versus a white person in society today, or a Hispanic person, and opportunities and policing and trafficking and prisoning and all that stuff. Just having those conversations, and that came out of it. So that it's $1 billion, but that $25 million is a critical element. We think we donated to help society just have the conversation we have in the company. We're not perfect. We got a lot of room to go, but we just we believe this grounding of this program comes out of our belief that we believe our company can help, along with other business companies, solve this big issue of economic fairness and mobility. If we solve that, some of the other issues start to take care of themselves.
So one final question, Brian. In one of your many global leadership roles as the head of the International Business Council and working in conjunction with the World Economic Forum and taking this conversation we just had, you just announced a whole series of new actual metrics for ESG, of which governance we've always had, but now we put prosperity, people, and the planet basically square in the middle of that. And in this discussion we're just having, just give us a little bit more about the motivation about that and what we should expect to see happening here.
Well, there's 3 or 4 elements that go to this, but clearly at Bank of America, we believe that we have to produce for our shareholders and produce for society. It's what Jim Collins, a great business writer, calls the genius of the and.
Yeah.
Purpose and profits, and you have to be able to do both. If you do or, I won't be CEO if I can't help the shareholders, and if I can't help society, our brand, our company's brand and employee capabilities will suffer. So that's one basic principle. The second basic principle is the world said, let's make progress on the SDGs. 2015, 2017, the IBC says we're making progress. The question is, how do you measure that? Yeah. And the third element was, for those of you that work with these standard setters, there's many, many standard setters in the world saying, here's how I measure your environmental impact, and here's another one how I measure it. So there's no standard like GAAP or FASB or IFRS, and so Klaus Schwab and the IBC, which I lead, and the big 4 accounting firms and our teams got together and created a set of metrics, 21 metrics against those 4 pillars, which exactly match the SDGs, that you can measure a company's progress. So what does that say? If you're an investor, I can look across all the companies in the industry if they're disclosing these metrics, and I can figure out who's doing a good enough job. I'm willing to invest in them. If you're a lender, I can do that. If you're a government, you can actually look at a set of metrics across it. If you're one of the standard setters and advocate for particular elements, you can look at it. So our human capital report, which talks about our mental health, that's in the metric system here too. So the idea is these metrics will measure the progress on the SDGs. In the end of the day, what I firmly believe is you're not going to solve these big problems unless you align capitalism to them. Ingenuity, innovation, money, talent, and energy. The governments have to help. So everybody has to help. But if you don't have capitalism aligned to solve these problems, we're not going to get them solved. And so these metrics align capitalism to solving these problems.
Brian, thanks very much for giving us this preview of ESG and all of the wonderful things that are going on with Bank of America. Your leadership is really critical here, not only for the bank, but for other CEOs around the country. Thanks so much for your commitment. You know, it's personal for me. My son, Brandon, lives successfully with schizophrenia, but your kind of leadership is essential. Thank you, HLTH, for the opportunity to have this courageous conversation. I hope you all got something from it. Bye for now.
Thank you, Garen.